Hi, I'm Dr. Morella Lascurain. I used to practice Western conventional medicine, but somewhere along the way I realized that attempting to manage illness by manipulating and examining just the body was just insufficient. So I decided to step away from conventional medicine and embark on the study of holistic ways of healing. You see, we humans are far more complex than just our bodies. We have emotions, and these can be loving and nurturing, or they can be extremely destructive. We have thoughts, which can be positive, but most often than not are negative and noxious. We relate to other people, to humans and animals and the environment, in ways that can be harmonious or extremely noxious. We have culture and spiritual values. And very importantly, we have a relationship with our work, which can be our place of fulfillment or a place of frustration and anger. All of these dimensions of personhood are intertwined, so that the body is not just a bag that can be filled with everything else. The body is the actual expression on the physical realm of the multiple dimensions of a whole person. There is no such thing as a purely physical illness. All the illness in the body is the result of a conflict happening in a whole person. This is applicable to all illnesses and not just those that medicine calls psychosomatic. Think of the last time you had a cold. There are constantly cold viruses in the environment. Why was it that you caught one that day? Were you tired, overrun? Had you been pushing yourself too hard? Just think about it. Mind-body healthcare aims at digging out those conflicts from the whole person so that these conflicts can be addressed and resolved. This leads to an increased sense of inner peace that is reflected with better functioning of the body and therefore a better state of health. Most mind-body practitioners use some form of psychotherapy to address conflict. It is my personal viewpoint that a lot of these conflicts are so difficult or painful to deal with that they tend to lie at a subconscious level. And this is why I have trained in a number of techniques that allow me and my patients to work in a subconscious realm. This kind of approach falls outside of the current purely physical paradigm of health and disease. And this is why there is little research available in the literature to support the practice of mind-body healthcare. However, the results I've seen in clinical practice are outstanding. And there is an increasing number of us who are more interested in treating whole people than bodies. So that there's, in the future, going to be a lot more research coming through, and eventually we will be able to to ground the practice on scientific evidence. So my invitation is for anyone to try mind-body healthcare if they have a condition that doesn't seem to be resolving with conventional medical treatment. This is not a one or the other approach in the sense that it can be used alongside medical care. However, there's nothing to lose, for it can only lead to personal growth and in many cases to healing.